All right. Good afternoon, everyone. The Senate Finance Committee is now in session for voting. And we'll have the analysts take us through the bills. Who's first? David?
Yeah, I am ready.
And remember, guys, our voices are muffled when we have to wear these masks. So everybody be sure to articulate as loudly and as clearly as possible. Okay.
Okay, the first bill on your list is Senate Bill 138. It's a fairly low number. This is a local bill that involves collective bargaining rights for non-supervisory, non-management employees of the Baltimore County Public Library. The bill has the support of the local delegate of the county, the Baltimore County Senators, and establishes specific and comprehensive collective bargaining rights for these non-management supervisory employees of Baltimore County Library.
All right. Senator Klossmeyer is chair of our delegation, but she sent the delegation letter. So can we get a motion from someone?
Move favorable. Second.
All right. It's been moved and seconded. Any discussion on the motion? All right. All in favor, please raise your hand. I'll go ahead and vote for it. It's crazy.
They worked it out.
Okay.
Anybody opposed?
Okay.
Senator Reedy doing?
It's a
Senator
local
Reedy,
bill, yes.
what's your vote?
I'll pass.
Okay. Okay. That's right. All right, we'll go next to who?
The next bill on your list is Senate Bill 514. You have a reprint in front of you. This bill was worked on by the House or Health Government Operations Committee for most of the session, and what you have as a reprint in front of you are consensus amendments amongst the Hospital Association and consumer groups. I'll go through the reprint. Current law specifies that hospitals must follow procedures regarding debt collection policies. This bill expands those provisions that hospitals will be subject to regarding debt collection. In other words, the hospitals are authorized to go after patients who do not pay their bills. If you go to page 2 of the reprint, at the bottom, onto the next page, this brings in part of the law that was amended last year regarding financial assistance policies. Last year there were significant changes made to that law. First off, on page 3 at the top, that part of the law is amended to reflect the fact that COVID has come up and people whose financial situations may have changed because of COVID now who were previously not eligible for financial assistance policies could be. So this creates an opportunity for those folks, if their financial situation changes, to be also eligible for financial assistance policies. Further down after page 11, there's a consensus amendment that allows for a patient to initial, doesn't require, but it allows for a patient to initial that they received the financial assistance policy when they leave the hospital. On the middle of the page, the bill is introduced included additional requirements that a hospital must submit to the Commission regarding its debt collection policies and the types of debt collected. On the bottom of the page, subsection B, this starts the existing requirement that a hospital must have a debt collection plan, and this plan must be submitted to the Health Services Cost Review Commission. The details of the plan then follow, and these details have been expanded by the bill as introduced. If you go to page 4, and with the amendments and consensus amendments, there was additional items added that the hospital must consider when they're establishing their debt collection policy, and a lot of this is also expanded in subsequent parts of the bill once you get past the requirement that they have a debt collection plan. There's also changes consistent with the language for the financial assistance policy on lines 13 through 16 regarding within 240 days after the initial bill. The bill came in talking about post-discharge bill, but throughout the law, it's the common usage is initial bill. So everywhere it was first discharge bill, it was amended back, and this was part of the negotiated agreement to be the initial bill. So any notification process in the bill starts after the initial bill was provided, not the first discharge bill. There's also change throughout this section. There's references to patients who may be eligible for free or reduced cost care. In some cases, the negotiated changes strike reduced cost care, particularly related to refunds, because if a person is discharged from a hospital and then subsequently determined to be eligible for free care, they would be eligible to have whatever they paid as part of their bill to be refunded. So this particular requirement only, regarding the refunds in particular, that only would apply to those patients who are eligible for free care. The distinction here is that if you're eligible for reduced cost care, you also have some ability on your own to meet your obligations to the hospital. At the bottom of the page, there's a change throughout this law. The original law said an outside collection agency. Throughout the bill, it's changed to debt collector to be more specific in who you're talking about here. And further at the bottom, there's additional requirements that would require a hospital to put into their debt collection plan, prohibit the hospital from collecting additional fees in the amount of excess of what it was. So a hospital would be prohibited in their debt collection plan to charge additional fees other than what the patient would owe on a bill. Again, there's changes here, approved charge for the hospital service as opposed to cost of the hospital service, which is more consistent with current practice and what the Health Services Cost Review Commission allows a hospital to charge for a bill, since all of these charges are regulated by the HSCRC. In the middle of page 5, there's language here that was added in the bill originally regarding interest rates. So the bill specified a minimum interest rate that could be charged on a hospital bill. That was struck, and instead it was replaced with language that says a hospital may not charge an interest on fees on any debt incurred by a patient. But this is not completely inclusive. There is a circumstance where interest may be allowed, and I'll get to that in a moment. If you go down to the bottom, the next subsection E, this relates to installment plans. So right now under the law, there's nothing about a detailed installment plan that a patient may be given if they incur a hospital debt. There were also changes to here as the outcome of the negotiations between the Hospital Association, HGO, and consumer groups. If you go to page 6 of the reprint, you'll see most of the original language regarding an installment plan has been struck. That's lines 7 through 23, and it was replaced with a agreed-to process in which the HSCRC shall develop guidelines with input from stakeholders on an income-based payment plan that should be offered to patients. The details of the income, what they have to negotiate or discuss in putting into this plan follow. The amount of debt, it should include the amount of debt owed, the duration of the payment plan, guidelines for the payment amount. A lot of this was in the bill as introduced and would have been mandated, but these are just some of the guidelines that they have to put in their plans, such as may not exceed 5% of the individual patient's federal or state adjusted gross income, shall consider financial hardship. And at the bottom of the page, you'll see this is where interest rates come back in, the determination of possible interest payments for patients who do not qualify for free or reduced cost care. So there was a distinction made. Some folks can pay their bills and just don't. So in those cases within the payment plan, that if you're not eligible for free or reduced cost care, then you can be assessed interest charges on your bill. If you go to the next blank page, because it continues on because of the amendments, there's again a prohibition on interest payments for patients who are eligible. It reiterates that there's no interest payments for patients who are qualified for free or reduced cost care. And again, there's no action. Once this bill becomes effective, a hospital may not seek any legal action against the patient until these guidelines are in place and developed. So it's going to be important on a hospital to come up with, to negotiate with the HSCRC to have these guidelines in place so they can continue to collect debt that patients do not pay for those, particularly who are involved with free or reduced cost care. Further on the line, there's provisions for missing payments. If the patient misses payments, they can renegotiate their payment plan. And at the bottom of the page, the hospital must make every effort to work with the patient before taking an act. It specifies that the hospital has to work with the patient before and make reasonable efforts to work with the patient before they can take actions to collect the debt, which includes going to a debt collector or taking an action against the patient. On page 7, there are some conforming amendments. Again, we take out first discharge and say initial bill. It also authorizes the hospital to use a third-party vendor to provide outreach to the patient for the purpose of qualifying them for financial assistance. New subsection F, this concerns hospitals reporting to consumer reporting agencies. There's a whole series of processes that will be put in the law that govern the circumstances under which a hospital can report a patient's information to a consumer reporting agency, and these are the folks that would determine your credit. They may not report this adverse information until they're sure that the patient is not eligible for free or reduced cost care. There are cases where there might be appeals that the patient makes because they may be eligible. Again, in those circumstances, the hospital can't report that information to a consumer reporting agency. And there are, at the bottom of this page, on page 7, there are instructions to delete, the hospital is instructed to delete, under these circumstances, the information that they report to a consumer if the person is determined to be eligible for free or reduced cost care. Page 8 of the reprint. These are general prohibitions that a hospital is subject to regarding debt collection. Some of these general prohibitions are in existing law, but they're greatly expanded, as you can see here. A hospital may not file an action against a patient to collect debt owed until 180 days after the initial bill is provided. So for the first 180 days, there can be no action in a court filed by the hospital to collect the debt. The idea here is to give the folks enough time to work it out with the hospital, some sort of payment plan or whatever else. A hospital can issue an arrest warrant against the patient. A hospital may not request a writ of garnishment of wages. And on lines 23 and 24, this was very important in negotiations in the House. And I believe this is the amendment that got a lot of people on board. A hospital may not make a claim against an estate of a deceased patient to collect debt owed on a hospital bill if the deceased patient was known by the hospital to be eligible for free or reduced cost care. So essentially, if the hospital knows that this person is eligible for free or reduced cost care, they cannot make a claim against the estate. Otherwise, they can make a claim against the estate for those folks who aren't poor enough to be able to pay their bills. A hospital may not file an action to collect a debt owed on a hospital by a patient until the hospital determines whether the patient is eligible for free or reduced cost care. That's the bottom of the page. Page 9. Subsection 8 at the top. This concerns the liability for owed debt by a patient. A spouse or another individual may not be held liable for the debt owed by the patient. However, an individual may voluntarily consent under the conditions that are specified below to take over the debt of the patient. Subsection I in the middle of page 9, this concerns the process for filing an action a hospital must use when trying to collect debt. At least 45 days before filing the action, the hospital has to send written notice of intent to file an action to the patient. The details of this written notice are included below lines 19, and all the information that must be included. Which goes over to on to page 10. Finally, and I'll point out lines 20 and 21. So the information in the notice is included before that, but there might be other relevant information prescribed by the Commission through regulations that would have to be included in that notice. There are also further requirements that has to go along with this notice. You have to provide information on financial assistance policies as part of the notice. So there's numerous instances throughout this bill where the patient has to be provided the information that they might be eligible for financial assistance. On page 11, this starts the process for a hospital when it does initiate an action. First, it talks about that they can refer to a debt collector, but at least in an action, as part of an action, they have to provide an affidavit, and the information that's included in the affidavit follows on lines 9 through 18. This is on page 11. And there's also information that has to be provided in the action that the hospital complied with the law up to this point before it actually initiated the action. In other words, they had to say, we made every effort to come up with a payment plan. We made every effort to acknowledge that this, try to find out whether this person was eligible for free or reduced cost care. All that information has to be put into the information that would be brought to a court of law. And if you go to page 12 at the top, there's other contents that must be included in a complaint that goes to an action. At the bottom of page 12, there hasn't been many changes here regarding the circumstances on when a hospital may delegate collection activity to a debt collector other than changing outside collection to debt collector. So all the existing provisions of law governing this delegation really aren't changed that much by the bill. On page 13 of the reprint, there's a report required. The Health Services Cost Review Commission in the middle of this page is required to collect and report information to finance and HGO on the debt collection practices of hospitals. At the bottom of this page is uncodified language added. This is identical language that was put in, that's actually in the law regarding them developing a process for coming up with a payment plan that can be offered to patients. It's uncodified here because the effective date of the bill is in the future. It's not a normal effective date, but the Health Government Operations Committee thought it was important that they start work on this immediately or as soon as possible. So it's put here on codified language for them to start up this process of developing a payment plan. The next, I guess the last page of the reprint, there's an additional reporting requirement or a study required of the Health Services Cost Review Commission. They have to study the impact on uncompensated care on the debt collection process. And also it requires the Maryland Healthcare Commission to examine the feasibility of using the state designated health information exchange to support the financial determination of financial status of patients. And at the bottom, there's various effective dates here. The three uncodified pieces I just went through will become effective June 1st, 2021. So they have to start working on this payment plan on June 1, 2021 for the purpose of being ready on January 1st, 2022 when the bill becomes effective.
Okay. Yes, Senator Feldman.
Here, let me just quickly, I mean, a lot of work went into this product, which is why, the bill passed unanimously out of HGO and 134 to 0 in the House of Delegates. And I'll just say that, when you talk about the 2 years, last year we passed the financial assistance bill, which was important. This legislation is significant. I mean, as think about some of the important bills we're putting out of here this session, this is a significant move forward in terms of putting some reasonable guardrails that don't currently exist in Maryland law on debt collection practices. And so, Madam Chair, I just want to say that I'm surprised we got to a point where the Maryland Hospital Association can live with this, and the advocates themselves sent out a blast today supporting this version of the bill. I didn't think we would get there, but we did. And so, obviously there was some puts and gets, and it's not a perfect bill, and there's always future sessions, but this is a major step forward so that you don't get put into a financial ruin as a direct result of getting sick. I think this helps in a major way. So with that, Madam Chair, at the appropriate time, I'd move the amendments and then subsequently the bill as amended. So.
Okay, we got a motion and a second. Any discussion on the motion? Senator Hershey? Senator Hershey?
Just very simple, Madam Chair. I agree with the Vice Chair, and if I could be a co-sponsor, I'd appreciate it.
Okay, you'd like to be a co-sponsor. Okay. Anybody else interested in co-sponsoring? Senator Vidal and Senator Benson? Okay. All right. Any further discussion, Senator Jennings? You want to be a co-sponsor? Senator Jennings?
Yes.
All right. Is there any other discussion before we vote? All in favor, please raise your hand. Senator Hayes? Senator Hayes? We're voting. Okay, that looks like it's unanimous. Okay.
The next bill on your list is Senate Bill 894. This is the Post-Crisis Jobs Act of 2021, another of Senator Rosapep's bills designed to address the ramifications of the COVID crisis on various aspects of the Maryland economy and employees in the state. This one involves workforce training. There's really two parts to this bill. One authorizes digital learning throughout the code for in those circumstances where education or training, continuing education requirements for the licensed professions are required. And it's also an emergency bill. And then it establishes several grant programs in Maryland Department of Labor designed to provide additional funds. One, to convert to help people convert to digital learning, because that seems to be the new normal, and to provide additional training funds. There's a package of amendments that were offered by the sponsor. Most of these amendments are designed to get at some of the opposition and concerns in the bill. I'll go through them quickly. On page 2 of the reprint, this starts the insertion of language in every part of the code where there's a license or where the state authorizes that a profession or occupation or be licensed or certified or regulated in any capacity. So the first language would say that the digital learning means any type of learning that does not require a physical presence, and it encourages these licensing boards or licensing entities or regulatory entities to try to use digital learning where possible regarding education or continuing education. The first addition would be business and occupations and professions. On the bottom is business regulation, because several professions are licensed in business regulation. The same language would go for education. You'll see language struck on the bottom of page 3 through page 4. This was, the community colleges had a problem with this diversion of funds for apprenticeship, so the senator just struck that, suggested this language be struck. And now we go to health occupations on page 4. The same language is put in the health occupations article. However, there were concerns by the dental board, the pharmacy board, and massage therapy that some of their continuing education can't be done digitally. So he has that this requirement would not apply to those particular boards. At the bottom of the page, you've seen this language before. This adds to the unemployment insurance law. It's the same language that was put in Senate Bill 893, and it allows local workforce boards to connect with connect the unemployed with businesses who are interested in hiring them. So it allows information sharing between UI and the local workforce boards. On the next unnumbered page, this begins the miscellaneous grant programs. The first program starts on page 5. It is the Digital Learning Conversion Grant Program in MDL, and it's designed to allow students, apprentices, and employees to continue their education through digital learning and to provide assistance, financial assistance to employers. This is a grant program. In the middle of the page, you'll see the criteria specified on lines 14 through 25 to receive a grant. And at the bottom, there's language, and the sponsors had this language attached to many other mandated appropriations, and specifies that for the fiscal years detailed here in the bill, funding should come from the Coronavirus Response and Relief Supplemental Appropriations Act. So no general funds will be at risk here. It's expected that if this program is to be funded, it has to come from federal funds. And my understanding is there's $4 billion out there in these funds, and the governor and the leadership on the House and Senate are discussing how to allocate those funds. So it's quite possible that some of those funds could be used for this conversion grant program. And same thing on the bottom of the page, there's a mandated appropriation for fiscal 2023. The sponsor reduces that to $20 million, and again, the expectation is that federal funds be used for this purpose. There's further language that limits the amount of grants, and there's a report at the bottom of the page to the Maryland General Assembly about how the program is being implemented. On page 7 of the reprint, there is another grant program established by this bill. It's called the Basic Numeracy and Literacy Skills Grant Program. Again, this is the anticipation here is this program also be funded with virus relief funds, and the same holds true for the $20 million mandated appropriation. It limits grants to $5,000 and requires the department to develop regulations to implement this particular grant program. The next grant program is the High Growth Industries Workers Grant Program in the department. So it targets these high growth industries on page 8. You'll see what they are. And the idea is to create an opportunity for employees or workers to find employment in these high growth industries. And the purpose of the grants would be to provide grants for employers to hire these folks. If you go to page 9, the idea here is coordination between the Maryland Department of Labor and local workforce investment boards. They would be getting the funds to disperse to employers who wish to participate in the program. And then you'll see who's the type of employees targeted here: unemployed, youth ages of 16 to 24, adults, ex-offenders, and other populations in need of reemployment assistance. Again, the funds for this grant program are supposed to come from the Coronavirus Response and Relief Act. And the sponsor has an amendment that increases the actual money for this to $60 million. And again, it's expected to be all federal funds. And then last, there is a program for apprentices. And this specifies how much money should go to apprentices. Again, all the programs here are expected to be funded by federal funds, and that you are budget and tax is second on the bill, so they'll get a chance to weigh in also on at least on the money for the programs. And the bill is an emergency bill, and that's that.
Okay, is there a second? Okay, you have a question, or Senator Reedy?
Okay, so it may not seem like it because I've questioned some other bills. I really like the sponsor of this bill. No, I do, and he's very thoughtful, and he really is very smart, and I actually trust that he does his homework. With that said, we're like throwing stuff against the wall here. I mean, we just got this windfall of, is how we're treating it. It's tax money, but a windfall of federal money is how I think this General Assembly sees it. I'm a little uncomfortable with the idea of we're just going to start spending money because it's there. I'm all for workforce training. I'm all for some of these ideas seem great about getting more digital education so it's easier for people to get into a particular job. That's all great. There's a lot of ambiguity here, and it seems like we're almost like recreating stuff that they already have, or we're adding to. I mean, this is a lot for this late in session for, $110 million fiscal note in year 2, I think it is. I don't care whether it's federal tax dollars or state tax. There's all taxpayer money. I guess my biggest concern is when you get in my own life, if I was to receive a huge pot of money that they said is for like a rainy day, both for things you've experienced and things you're going to experience, I'd want to take a little time and really be sure I knew what I was needing before I just start saying, well, we're going to spend 10% of it here and 5% of it here. You know what I mean? That's not very specific, but I'm not sure we should just rush through a bill like this.
Okay, we'll go to Senator Hayes, then we're coming to Senator Bidle and Senator Hershey.
I'll pass for a minute and come back to me, Madam Chair. I tried to make a motion, but I see that there's other questions, so I'll wait.
Okay, Senator Bidle.
Thank you, Madam Chair. This really isn't rushed through, Senator Reedy. We worked on these issues for a long time on this COVID work group, and the issue of retraining came up regularly. And along with the need to retrain is a lot of shortages now in like hospitals, nursing homes, home health care, for an example. And so there are people that have been laid off from hotels and Uber drivers and all kinds of service industries that could be retrained to backfill the positions that we need. Our workforce development, and I can't talk about all the counties, but I can talk about my county. They've worked really hard on these digital retraining programs and would very much appreciate the funding to continue to reemploy people.
Can I ask a question, respond, because I'd like to know more.
Well, go ahead.
Yeah. No, I threw it all out there, and you're trying to answer me. I appreciate it, because I haven't been on the committee for a year, so I was only just put on right before session. So do we need this bill to keep funding digital programs, or is this additional stuff on top of what we've already been doing at the state level?
Well, to my knowledge, there hasn't been enough money. In my workforce development, who I'm really close to them, I talk to them frequently, they could have retrained many, many more certified nursing assistants and geriatric nursing assistants if they had the funds. They have the program, but they don't have the funds.
Okay, let me make one more point, and I hear that, so that makes sense to me. One other point, though, all this federal money we're getting, we really want to be careful about establishing ongoing expenditures that we have to pay. I know we're not the budget committee, but, so this looks like this isn't just spent, it says, as long as it's federal funds, but if federal funds run out, because this is ongoing, some of this stuff, right? Am I correct in saying that?
They're all limited. I don't.
Oh, it's all limited?
Well, the mandated appropriation part is limited. It takes you through to fiscal 2023, but
And then
there's
it
nothing.
stops?
Then it stops.
Okay,
yeah.
I thought maybe it was ongoing. I was curious about that. Okay, well, I appreciate the answer. I'm still a little uncomfortable, but I do appreciate that there's been a lot of discussion. It's frustrating, this situation we're in, because we can't have like a work group on this stuff and sit down and talk about it. I mean, some of you may have been working on it for longer, I recognize, but thank you.
Thank you.
All right, Senator Hershey.
Thank you, Madam Chair. Just on that same line, I want to make sure I understand. This only goes into effect if funds from the Corona stimulus package are allowed to go towards this type of program? Is that accurate? You kept saying it assumes that money's going to come from the COVID stimulus money for this, but I'm not understanding, because I guess it's in 3 or 4 places. It says for fiscal years 2021 and 2022, the governor shall include in the annual budget an amount of applicable federal funding allocated to the state under the Corona.
Yeah.
So it is forcing the governor's hands that any money that comes into the state has to go into these programs.
Yes, it would be, yes, under this particular act. Now, if there's no allocation, or somebody decides that they don't want to use that discretionary fund, that $4 billion they're getting for this purpose, then I don't think there's much the governor can do here.
That's what I'm saying. It's forcing his hand that he has to spend it on these programs. And my concern is the same, I think, as my colleague is saying, that I'm assuming that there are many, many priorities for this money. And how is it that we are ranking this piece of legislation as the most, or one of the most important, that says that he shall use that money for this? So I guess that's a broader policy question. If we all think that this is...
I guess I would say he got early into line, and he's sitting there as vice chair of budget and tax, so he knows.
I understand. I'm just saying, what we're tying our hands to. There's a lot of important things we're trying to. Kathy's not here. We're trying to work on something with unemployment insurance as well too. But the other question is, I guess after that it says for fiscal year 2023, the governor shall include in the annual budget appropriation of at least $60 million for something. So again, that's more mandated spending outside of the coronavirus stimulus money. It says that in 3 places as well too.
I assumed that it was all in this bill coming from the same source.
Doesn't
Feds for this purpose.
Well, on the one instance, it says, the first instance is $20 million for fiscal 2023 in federal or state funds. The next one is The next one would be 60 million for the department to fund the program, but it's not definitive on whether it would be federal or state funds.
I mean, I'm not a budget guy, but correct me if I'm wrong, it says the governor shall include in the annual budget.
Mm-hmm.
That makes it sound like it doesn't matter where it's coming from. At that point in time, I guess he or she has to do that.
If we
Right?
go back to the preamble of the bill, though, you can sort of see where the monies in general are coming from.
Well,
that this bill is
I know, Madam Chair, I'm just saying, I think this has a much higher mandated appropriation than just the federal stimulus money that we might be getting, and that's what's of concern to me. If it wasn't that, if it just said, hey, we want to take this stimulus money and do the things that my colleague has been mentioning here, sure, all for it. I understand that the work group has been looking at it, but that gives me concern that it's a much higher mandated
We're
spending.
going to Senator Jennings and then to Senator Augustine.
So my question is just ask for something, is following up my two colleagues here, is, we've got all this.
Remember, we are all muffled. This everybody.
We've got all this stimulus money coming. Do we have an actual itemized list of where? So my question, Dave, is with all the stimulus money coming on this, we just passed, the senator just had another act that he's passed that's got grants in it, and we're spending more money. Do we have any itemized list of where all this money's going?
It hasn't been determined yet. That my information is that the $4 billion is how it's going to be allocated and used is under discussion between the governor, the speaker, the president, and the budget committee chairs. So that they haven't figured out exactly how that $4 billion will be allocated yet. They're working on that right now.
And I would just say that whenever you get a huge sum with a short amount of time to spend it, you kind of have the conundrum you're talking about, but that's what the feds have already done. That's what the Congress has already voted. So if we don't, some other state probably will.
Well, I think the money's coming to us no matter what. I just want to make sure we're using it, in a responsible manner, and that we're not overspending our allocation. That, okay, let's do this, let's do that. We have all these different grants going out that we're going to come back and say.
Budget committees.
Yeah.
All right, Senator Augustine.
Thank you, Madam Chair. I just want to go back to what Senator Bidle was talking about and the fact that, we actually have spent a significant amount of time working on the recovery from COVID, which is what this is really all about, and that similar to some of the other bills, the outgrowth of this bill is sort of a lack of a unified vision that we have seen from the state, and so that this bill helps to put the stamp of the priorities that we have identified, strengths of our economy as a state, that we know as this new world that we're in, that's coming forward, that we have to be focused on these post-COVID jobs, and that's exactly what this piece of legislation does. It helps to drive in the direction of where the future economy is, and that's why I'm very supportive of this, understanding that it is in the context of receiving federal money to do it. I mean, we get the federal money, we know where we're going to go with it, so that we can set our future economy up, and that's why I'm supportive of it.
Okay, Vice Chairman Feldman.
Piggybacking on that a little bit, I mean, we had this discussion a little on the floor last week. Senator Riley, made a point about the other Rosa Pep bill. I guess the question I would have is, because you're talking about policy priorities, and last week it was about, everybody didn't seem to disagree with the idea that if we're going to have federal money, COVID testing, COVID vaccines, like what bigger policy priority could there have been? And we passed that law with federal money. I guess the same question would be is, when we talk about give me an example of a priority policy-wise that would be more important right now coming out of an economic downturn than job retraining and what's embodied in the bill. So I hear you that we want to weigh in with federal dollars wisely, which was a discussion we had on the floor. I can't imagine a better use of federal money right now than getting out of COVID with vaccinations and testing and retraining a workforce that's been out of work. And so somebody's going to have to come up and tell me what would be a higher priority right now with federal money. So.
And the thing is, we are a part-time legislature. We won't be here when maybe things are clearer as to what the relative needs are for even various types of work. So I think we have to do what we can. Senator Jennings.
Just clarification, I wasn't saying there was a higher priority. I'm just watching all these bills with all these $40, $60 million attached to them that it's, you know, I don't have a adding machine here to add up all the money to, you know, where's it all going? You know, how do we look in the outer years of this? That, you know, some of this stuff is, you know, going on for 3-4 years. Just, you know, as we always hear, you know, we're in a fiscally, you know, structural deficits that we're always dealing with. And just, that's my only concern is
Okay.
I think that's a totally legit issue. I would say that there's a reason B&T is second on this. So, you know, we do have a budget committee that's in theory is responsible for managing the budget, and they have to sign off on that, number one. And I do think there's a difference when we're dealing with, I know it's all taxpayer money, but it is a difference when we're talking about federal dollars as opposed to a state budget, balanced budget. I mean, I kind of feel like it's not quite the same analysis here. And so, but we have B&T has to weigh in on this, and they're supposedly, you know, going to keep our balanced budget balanced. So.
Okay, we'll go back to Senator Hershey.
Just very quickly, who is it that actually applies for these grants?
Spelled out in the, who's eligible is spelled out in the bill. So under the Digital Learning Conversion Grant Program, grants are available to applicants on a competitive basis. Applicants may include an employer or apprenticeship sponsor, public or private training providers, colleges or universities, and State Department of Education or a County Board of Education. So that's for the Digital Learning Program. For the
Can you just go, I mean, the reason I was asking, I looked and I saw that the community colleges were favorable with an amendment.
They're taken care of by the striking of the, if you go to the earlier part, they had a problem with the 75%.
Right, on page 4.
Yeah, they had a problem with that, so
Okay.
Senator
So-
Rosepep took that out.
So they would be eligible for these grants when you said universities?
Yes, I would think so. Colleges or universities, doesn't
Okay.
specify.
Yep, I see it there. Okay, answered my question. Thank you very much.
Okay. Yes.
For myself anyway, or question, comment. So I'm looking at the testimony from the Department of Labor, because again, I come back to this issue of the spending and where we're putting money. And I recognize, of course, workforce development is an important thing that we want to promote and support. There are things already happening. Maybe money can be added to it. You know, in their testimony, which I checked, the date of their testimony was March 17th. So this wasn't a bill from like February 1st before the bill passed at the federal level. They said the department's not aware of any federal funds that can be diverted to these programs and activities for any fiscal year. Federal workforce dollars are provided to the state for very specific purposes and often distributed by specific formulas. So their concern was that, and of course it's a letter of information, and I understand we all get frustrated with that, but the governor cannot commit federal grant dollars for these sources of the program unless it's very specific. So again, and I'm sitting here, I'm obviously, as I said, a little bit of disadvantage because I know I'm commenting, and some of you have been working on this issue for a while. When we say it's going to go back to B&T, that's why we have B&T. Well, that's great, but again, we all have to cast a vote here, and I just remain concerned. Maybe somebody could tell me about these grants, but that they don't have to be specific. But I remain concerned that, you know, I'd like to have experts up here telling us we want to do this because of X, Y, Z, you know. So can anybody explain that? They're like address the concern in the letter that these federal that money for workforce development grants from the feds have to be used very specifically.
Would you say that the whole world is in a state of ambiguity right now? We are part-time legislature. We're almost at the end of this session. we aren't going to get all of the specificity and clarity that we would like. But in general, given that these funds are for workforce development and to deal with some industries are going to disappear that were healthy, and others are going to take the place. Some will be heavily modified. The governor is going to be here all year working on it, but we need to give some guidance and some direction.
I just don't like voting in ambiguity. I mean, in a ton of
That
ambiguity.
is what they pay us the big bucks for.
Well, I don't know. I would argue.
I mean, the point is,
differently, but-
do we just leave here and do nothing? Or do we speak on behalf of the people back home and all of the people in industries that are on their last leg, and those that are heavily being modified, and those that are on the rim of coming into being and that look promising? All right, we got a motion. Do we have a second? Okay. If no further discussion on the motion, all in favor, please raise your hand.
Madam Chair, I would just ask that I'd like to make sure the Budget and Taxation Committee addresses at least the outgoing spending. Yeah, I mean, I
They
like
will.
the outgoing spending is what's my concern, but
Okay,
thank you.
thank you. All right, who's next?
The next bill on the list is Senate Bill 398. This deals with petitions for emergency evaluation, which is a process that takes place when a petitioner believes that an individual has a mental disorder and presents a danger to the life or safety of the individual or to others. There is a reprint that reflects amendments from the sponsor, beginning on page 3 of 5 of the reprint. As amended, the bill authorizes specified health professionals or health officers who petition for an emergency evaluation of an individual to, 1, take the evaluee to the nearest emergency facility, 2, give the petition for the emergency evaluation to another health professional or health officer who will take the evaluee to the facility, or, as is currently authorized under current law, give the petition to a peace officer. Moving ahead on page 4, a peace officer must promptly respond and assist in the transportation of an evaluee if requested by a health professional or a health officer. A health professional or health officer who brings an evaluee to an emergency facility must specifically hand off the evaluee to a licensed healthcare practitioner before leaving the facility. That takes place on the top of page.
Let me butt in and ask a question right there. Is that to keep us from doing what often has happened, that the people are brought to the emergency room and left by the medical providers or their entities who bring them, and then they sit there unaccompanied with no assistance and no introduction to or receipt by the entities that are expected as medical personnel to diagnose and to treat?
So that's not quite the situation that the bill addresses. Under current law, you would have a petition would be issued, and then that petition would be given by the petitioner to a police officer who would then take the person to the emergency facility. And under a bill that we passed last year, the police officer would actually have to remain if they were asked to do so by someone in the facility. And that was out of concern for the health and safety of the hospital staff. There had been some incidents where emergency evaluees were brought to the hospital, and then they attacked and severely injured nurses and doctors. So we passed
Would you say that's because we don't have a proper handoff?
Well,
We sort of
it was
have
because
a police
it was
officer who, in many cases, the best one to have had to transport and to in the first place, and they don't have the medical training they need. And then if you just leave them sitting there, even for people that are there for other reasons, where it isn't mental disability of any kind or emotional stress of any kind, to sit there can drive people nuts, and you can sit 5, 6, 7 hours.
Well, in the case of Chapter 488, last year, which is not this bill, that provision to require the officers to stay if someone asked was because people in the hospital feared for their safety because there had been cases of evaluees brought to the facility who then assaulted someone. And we received testimony from a physician who had been severely injured and took months to
Well,
recover.
does that mean that we need more immediate handoff? Maybe that's what's missing. Because if they come and you're already in emotional or mental distress and you're in a breakdown, and they sit you in a waiting room, even people that go in there calm and sane and thinking they're in their right minds can almost go crazy sitting there 5, 6, 7 hours. So that's what my concern is.
The bill, I think, is slightly apart from that. That is not what the bill is driving after. The handoff provision was an amendment that was made I think, to address some of the concerns by the hospital staff or people representing the hospital staff, because as introduced, the bill said that the health practitioner or health officer need not stay. But so the change to require the handoff was to make sure that the hospital staff was aware that someone had been brought in who was subject to a petition and had been determined by the court to be a danger to themselves or to
And it
others.
seems that should be such an emergency. If the courts have made that decision and they're being brought in there for that reason and they are known to be in a state of mental emergency, that it ought to be more immediate than somebody there checking for a cold. It would seem to me that a part of the problem is a lack of urgency on the part of the hospital staff.
And the bill does not really address that issue. The purpose of the bill is to expand the list of people who are eligible to take someone who is the subject of a petition to the hospital. So currently, what the healthcare provider would have to do is give the petition to a police officer who would then be responsible for transporting the individual. Under the bill, that healthcare provider themselves would be authorized to go and pick up that person who is subject to the petition and then take them to the emergency facility.
And leave them sitting in the emergency room with all the other patients there for other reasons and without any immediate attention from medical personnel. All right, Senator Kramer.
Madam Chair, I think your point is very valid, but I think that counsel was making the point that that's not this bill. This bill deals with whether the individual can be brought to the hospital by someone other than the law enforcement personnel. And the concern, and I've got multiple letters here from nursing associations in the state saying their concern is if you do not have the law enforcement personnel there at the time the person is being in this terrible mental state that we're discussing, that it puts them at risk for physical harm. And they're concerned with this bill because the bill does not provide for there to be someone from law enforcement to protect them from the individual. If the individual is in a state that may result in violence, they're unprotected. They're saying, we're the staff. We want to help, but if this individual is violent, we're going to be the ones who suffer the harm of the physical violence. So that's what their concern is with this
I understand
bill.
what they are saying. My point is that they got the horse before the cart, or vice versa.
Anybody has...
If in the first place, the police are some of the worst ones often to have to deal with the whole situation. We need to have a different cadre of people. But if they take them, they shouldn't be left in an emergency room and the police can't sit there and babysit, and they aren't trained.
Under this bill, they'll still get left in the emergency room, Madam Chair. This
Well,
doesn't
we can
change that.
we can make amendments to the bill.
Well, but what are we going to amend? How are you
Well,
going to
that's
amend
why
it?
I'm asking the questions I'm asking. I
Well-
think it is short-sighted to just leave the person who's out of control and in a state of mental emergency, either with a police officer who often can make, you don't even know what's happening during transport. They can make it worse because they aren't trained to handle it well. Then to say that the people worried about their health are the people that you expect to help them. So they shouldn't be ever left in the emergency room. They ought to be immediately helped. Even if it's some kind of a needle you can give them to calm them down. So you can begin to help them.
That certainly, I think we're all in agreement that that's a problem. And if you have an amendment for this bill that addresses the concerns of our emergency nurses and physicians who have submitted testimony saying they're worried with passage of this bill that they'll be put
I
at risk
hear
of physical harm. So if you know,
But I can't agree with them. I think if there's anybody who should be able to help, it's them. They're the ones trained to help a person in a mental emergency.
person is
But they've
physically
got to
violent
not
and
leave
starts
them sitting
punching
from
them in the
out.
face, Madam Chair, who is going to be the person there to step in and protect them if you have a person in distress who's violent and starts punching them, kicking them, hitting them with an instrument of some kind? Who is going to be the one, even
You
if
want
you're
it to be the
even
policeman.
if you get right on the case, who's the one that's going to protect the emergency room personnel? That's the issue that they've
well, you
raised.
I hear them, but I don't agree that it's valid.
Well,
All right, Senator Hayes, and then we're coming over. Who is this? Okay.
I guess now I'm confused. I'm not sure where the committee is on this, but I do want to remind you all that we received a letter from Baltimore, Behavioral Health Services of Baltimore just a couple of days ago in opposition to the legislation, mainly because most recently the HSRC had an RFP that was solicited to various jurisdictions. I know the award to the Baltimore area, which includes Baltimore and I think the surrounding counties like Anne Arundel and Baltimore County maybe, is called the GBRICS, where they were awarded $45 million to have a multi-pronged approach of a 24-hour hotline as well as a mobile task force that would be armed with the services that need to be provided to address this population. So I don't know really where the committee is, but I would, I was asked to just raise the testimony that was provided by Behavioral Health Systems of Baltimore that should be held in our committee reports.
Senator Feldman?
Yeah, just listening to the discussion here, Madam Chair, I'm not quite sure the bill's quite ready for prime time. I think this might be an appropriate bill to hold. If it is the will of the committee, I just don't think the committee's quite ready to take a vote on this bill.
Is that a motion?
So I would, well, it's not really a motion, it's a request for a hold on the bill.
Do we have a second? All right, Senator Jennings is second. All right, all in favor by holding the bill for a while? Okay. Raise your hand. Let's see what we're doing. I'm not sure. If you're agreeing that we need to hold it. Okay. Okay. Do you have till a time certain?
April 13th.
Do we want a work group on it? Okay, all right, I'm just asking. Okay.
The next bill is Senate Bill 740. That's an emergency bill. It's sponsored by Senator Rosapep. The bill establishes the Maryland COVID-19 Small Business Grant Program in the Department of Commerce. The program provides funding to counties to issue emergency relief grants to eligible small businesses in 2021 and 2022. under eligibility criteria and program parameters that the county is generally responsible for determining. A grant under the program must be funded through, one, to the extent available federal coronavirus relief money provided to the state, and two, to the extent that federal coronavirus relief money is not available, state coronavirus relief funding. The bill includes a provision that specifies it's the intent of the General Assembly that $100 million in federal and state funds be designated to the program, but this is not a mandated appropriation.
Okay. All right, who's got a motion? All right, do we have a second? All right, been moved and seconded. Is there any discussion on the motion?
You got a question?
I feel like I should ask a question. I don't want to be hypocritical.
I know, no questions called.
Okay, all in favor, please raise your hand. Okay, that one passes. Okay. Is there anything from today that you guys want to deal with, or just hold them till we vote? What did we say, Thursday?
We're voting tomorrow.
We're voting tomorrow. Okay. All right. Thanks.